My name is Erin Colburn. I am the Pre-Health Advising Coordinator for the College of Health Science here at Boise State University. I'm joined with Shannon Kerr, our other Pre-Health Advisor. We serve students who are interested in going into pharmacy school, medical school, and all these different pathways. And we are excited to be joined with the College of Pharmacy at Idaho State University, Dr. Fitzgerald. So I'm going to turn the time to him and let him chat with us a little bit about his program.
All right, thank you, Erin. It is truly a privilege and an honor to be here. I have passed by Boise State many times coming to Meridian from Pocatello and even driven around the campus, but this is the first time I actually entered a building. So I appreciate the privilege of being over here. I'm here today to talk to you about pharmacy, but we'll be glad to answer any questions about any of our healthcare programs. Let me say at the outset that a couple of years ago, the Division of Health Sciences had 4 colleges at ISU. Those have now been collapsed into 2, the College of Pharmacy and the College of Health. In the College of Health, there are 41 health professions programs, ranging from PA, nursing, communications, but we also have in the College of Technology a few programs in healthcare, such as pharmacy technician program is over there. And I believe the LPN program may be there as well.
I think the PTA program is too.
The PTA is too.
OTA.
OTA and PTA. So when you look at ISU for a health profession career, you're looking in 3 different colleges. Of course, pharmacy being pharmacy only. Makes sense, right? So I want to talk about pharmacy, but I want to be sure you did understand that we do have a lot of health professions programs at ISU. In the College of Pharmacy, we have great opportunities for admission. So if you're interested in pharmacy, now's the time to apply. In our nation, we have more seats available for students than we have applications. I never thought I would ever see that happen. But back in the early 80s, when I joined the University of Tennessee College of Pharmacy as a faculty member, we would have 1,500 to 2,000 applications. And now it's in the 100 to 200 range that we see at ISU. I think that opens the door to wondering, well, why have applicants dropped off? Well, part of it, I think, is COVID. I think part of it is that other health professions have really grown into their own recently, and I'll use PA as an example of that. PA programs, that's where the light is shining right now. They get all the applications. Medical school apps have spiked a little bit because of COVID-19 we're here, but that's kind of driven people to be interested in medical school and going into medicine. One of the things that's unique about pharmacy is that the practice of pharmacy has changed more in the last just couple of years than it has in the 40 years that I've been in pharmacy education. I joined the University of Tennessee full-time in 1983. So we're approaching 40 years. That's scary to say. But in just the last couple of years. So the other day, one of my faculty members called me and said, Dean, I've had a call from the State Department of Professional Licensing, DOPL as it's called. And they want to know if we can put together a training program for pharmacists on delivering IVs. And I thought, well, wait a minute. You just put the IV bags in the box and you deliver wherever they want it. I don't understand. And she said, oh, I'm not going to administer. And I said, so wait, you're talking about us in pharmacy starting IVs? Yes. And I don't know if you've seen this or not, but in a number of states in the last just couple of weeks, they are authorizing pharmacists to prescribe and administer COVID-19 therapy. Not just vaccines, but now therapy. I think you're going to see infusion operations. I won't call them infusion centers. That would be a little too much overstated. But infusion opportunities in community pharmacy, hospital pharmacy practice. So ISU is looking at developing a program that would allow pharmacists to receive the necessary training to begin IVs to administer monoclonal antibodies is what we're talking about in this. Now in Idaho, and one of the reasons, and I just got to Idaho a little over 2 years ago, just in time for the pandemic, which has been really frustrating as a new dean of the college of pharmacy, is that all the 6 months I was there, the things I saw, opportunities we have, and then wham, everything stopped, right? So one of the reasons I was interested in coming here from Knoxville, Tennessee, I know the accent didn't give it away or anything, right? From Knoxville, Tennessee, where I was dean of the College of Pharmacy, was the Practice Act in this state. And Practice Acts are of interest to me because in addition to being a pharmacist, I'm an attorney in the state of Tennessee, which is, by the way, another nice thing about pharmacy. There are a lot of other degrees you can add on to the pharmacy degree. The advantage of the pharmacy degree is it's a 6-year degree book. 2 years of pre-pharmacy, you can meet all the prerequisites and materials that I'm leaving. And then 4 years in the PharmD program, well, also is 3 years. So that's a total of 9 years, right? My son is a 3rd-year medical resident at University or Augusta Medical Center. I'm sorry, I'll get it right. Medical College of Georgia in Augusta, Georgia. And he's on year number 12, I guess, in getting into medical preparation. And of course, if he wanted a subspecialty, he would be looking at another 3 years. So pharmacy is a great opportunity. We have a dual degree program for PharmD MBA and now PharmD MPH. And that's a unique program because that MPH degree is in collaboration with ICON, the Idaho College of Osteopathic Medicine here in town, which shares our campus with us out over in Meridian. But back to my other story, the Practice Act. Idaho's the only state in the nation where if I feel like I might have symptoms of the flu, I'm going to pharmacy. Pharmacists can do an influenza type A test that's positive prescribed, and the antiviral that you prescribe within their diagnosis. Or if I think I have strep throat, I can go in, have a strep test performed, and they can prescribe the appropriate antibiotic choice if it's positive. So pharmacy has great opportunity in this state. And that's what's unique about teaching in this state. Our accreditation body requires that we prepare practice-ready pharmacists. In the state of Idaho, that's a higher elevation to be practice-ready because of the prescribing components of what we do in Idaho than in other states, even some of the contiguous states to Idaho. So we're very excited about our advanced level of teaching toward a growing and expanding profession of pharmacy. Now, I can remember in the day, in the 80s and 90s, when I was on the admissions committee and I would be interviewing applicants, and they would say, well, I want to go to pharmacy school, but I don't have to touch anybody, I don't have to draw blood, I don't have to do any of that stuff. Well, those folks wouldn't get into pharmacy school now because we do those things now, including, as I'm saying, starting intravenous solutions. If there is a silver lining in COVID for pharmacy, it is that it has expanded our practice. Now, not only are pharmacists doing COVID testing, vaccinations, we've been doing vaccinations for some time now, but the Centers for Medicaid and Medicare Services issued authority for pharmacy technicians to also be authorized to give immunizations or administer immunizations. We already had that authority in Idaho. I remember being in Tennessee when the news hit that Idaho had authorized pharmacy technicians to give vaccines. Pharmacists in other parts of the country weren't so excited about that. What are they doing out there in Idaho? That's when I first started getting interested in what is going on in Idaho. So pharmacy technicians are moving into more advanced roles. And that allows pharmacists to also expand their advanced professional clinical role because the pharmacy technicians are doing some of the things that pharmacists have been tied to doing from a technical dispensing standpoint, so that they can now spend more time with the patient. And there are lots of opportunities outside of community pharmacy and hospital, which is where the majority of our students, graduates, go to community pharmacy practice because that's where the majority of pharmacies are. But over in the hospital and clinical world, there are all kinds of opportunities. I thought those were for me. Those of you that see this video, there was a gentleman just showed up at the door with a bouquet of flowers. Couldn't get in. But so I think that when you look at practice expansion and opportunities, it's unknown. It's what you want to do with your degree. You can add other degrees to it, or you can start your own business. There are pharmacists that are starting practices that have no medications in it. They're becoming limited services types of licenses with state boards, and they're doing these clinical services. So those individuals that might have thought about medicine or PA or nurse practitioner, going the nursing route into a nurse practitioner program, pharmacy now offers a lot of that same opportunity for prescribing. And let's face it, prescribing is the thing that is that big differential between the different health professions, whether you prescribe a drug or administer a drug. So the pharmacist growing in its authority, the pay scale continuing to stay up, even though there is some shrinkage in the market with some of the big chains like Walgreens and CVS closing some of their units because they really grew the number of units. There's still plenty of jobs for pharmacists. The thing you might hear sometimes, there are pharmacists who are burned out because of working in an environment that is so heavy dispensing. All day long, they're just trying to keep up with the volume of prescriptions they're trying to prepare to dispense. And that's part of, the practice side of pharmacy is people need meds. Somebody's got to provide those meds, but there are many more opportunities there. But some of those pharmacists are getting burned out and speaking negatively about pharmacy lately. Don't let that sway anybody whether you go to pharmacy school or not. The majority of pharmacists, the great majority, love what they do and care for patients. And you might read some things. I remember reading a pharmacist's comment on a networking site for pharmacy that said, I dread the day the COVID vaccine comes available because they're not going to give me any more staff to help me administer all these medications because I've got this staff, that's all I want to get. We are working at the college as we are nationally to make sure that the big employers of pharmacists understand what the pharmacist's role will be. Because the model in community pharmacy has always been what? Quantity, volume. I mean, that was always the big question when I was early in my career in pharmacy. How did you feel today? That's no longer the question. Have you had any pharmacy experience working in pharmacy?
No, I haven't been able to because of COVID.
Okay. But that was the big question. How did you feel today? The question now is how many vaccines did you give today? How many prescriptions did you issue today? So we're changing that metric about how pharmacy is judged in its success from a business or clinic standpoint. Now, recently in Idaho, you may have heard of Bengal Pharmacy, Idaho State University, Bengal Tiger. Bengal Pharmacy was started in Pocatello. It was owned by the Idaho State University Foundation. We had locations in Arco, Kendrick, Chalice, and Council. We have closed the Kendrick location recently because the volume just was not there to sustain that operation. But out in those areas, we have pharmacy technicians. And they are filling prescriptions via telepharmacy with our pharmacy in Pocatello. So we have pharmacists that work in the Bengal Pharmacy. It's the full line pharmacy. But if a patient walks into one of the pharmacies, like in Chalice, our pharmacy is on the property of a federally qualified healthcare center. So if somebody comes from there with a prescription, comes to the pharmacy, it's prepared and dispensed, but with oversight from the Pocatello pharmacy. Back to that technician role. There's not a pharmacist in that pharmacy location in Chalice, Council, or Arco. That's a great opportunity for telepharmacy. But recently, the foundation decided it did not want to be in the pharmacy business anymore. And we in the College of Pharmacy were given that business enterprise. What we are going to do with that business enterprise is we are going to work to grow reimbursement for pharmacists because a lot of the things pharmacists do are not compensable. For example, under Medicare, we're not involved in Medicare except for dispensing. So if we're not a provider under Medicare, really only two groups that aren't providers under Medicare, us and veterinarians. And so we know why veterinarians aren't there, right? Because we don't pay for animals under Medicare. So there's federal legislation, by the way, that's gotten a lot of traction because of COVID-19 to make pharmacists providers under the Social Security Act so that we could go Medicare. We also have 3 campus locations here in Meridian, well, over there in Meridian, over in Pocatello, way up in Great White North and Anchorage West. In Anchorage, they have been working with this research project called 7 Up. And they are dropping claims now on the medical benefit side and being reimbursed and compensated for this. So we're committed to doing that. We're going to take bingo pharmacy and make it an exemplar of what community pharmacy should be like. And we have a lot of student involvement in that. Our pharmacy students work there, they pass through there. But excitingly, we are bringing a bingo pharmacy location to Meridian to our campus. And it is going to start out as a vaccination clinic initially, because we just don't have the space dedicated right now for a pharmacy operation, but that's in our future. So, it's that we want to transform practice. We want to leave practice better than when we entered it and when we leave it to those behind us. One of the ways to do that is to create exemplary pharmacy practice. So we're really focused on doing that. We have another reason to do that. Idaho is very progressive. A couple of years ago, Idaho authorized psychologists to prescribe psych drugs. And so we all know the difference in a psychiatrist and a psychologist. Psychologist is a PhD in psychology, it's a kind of research academic oriented. Psychiatrist is an MD or a DO that did a psychiatric residency. So they can prescribe because they're either a physician MD or physician DO, osteopathy or allopathic. Well, in Idaho, with psychologists being able to prescribe, you have to complete a master's degree. So it's somewhat like the nurse practitioner concept. You come out of the BSN program and then you get the MSN and now you can prescribe and get certified as a nurse practitioner. Same kind of concept academically. We have that program in the College of Pharmacy. And St. Al's here in town recently advertised for a prescribing psychologist. So one of the things that we are doing in the College of Pharmacy is we are trying to transform some of the practice that we have some involvement in. And we're not transforming medicine because we're not involved in medical school education. But we see a great opportunity. And we're doing research around those things. And I think, I just think, when you look at Idaho, it's 49th in the nation. Last time I checked, it could have changed. The 49th in the nation for access to health care. And we've got the ability to make a difference in that. The psychologists have the ability to prescribe. So I want our College of Pharmacy to become nationally recognized as a place that has transformed how we've done things in the past. I've been waiting 40 years to see this kind of thing, and I am committed to it as dean of college. And the faculty is good. So we've got great faculty, great students, everybody's in support of this. We are in the process of adopting a new strategic, updating our strategic plan, put all these things in there, and grow our success as a college of pharmacy. The other health professions on campus are also doing the same kinds of things. We've invited some of those other health professions programs to bring their programs to Anchorage, Alaska as well. University of Alaska Anchorage welcomes the ISU health programs. And so we want to grow our footprint. Yesterday, in another presentation, I was asked by 2 individuals who want to go to pharmacy school, do you think you'll have an online program? So I know that COVID-19 has changed the world of higher education indelibly. I mean, it's not going to change back to be what we used to be. I don't think. I'm not an expert in higher education, but I've been around it long enough to have a little bit of vision. I think we're going to see a lot of change. There are online pharmacy programs now. And these two individuals asked me if we were going to start an online program. And I'll let you know that there are online programs. Creighton University has one. University of Colorado has an online option. LECOM, Lake Erie College of Osteopathic Medicine and Pharmacy. And so I'm thinking, as they said, it'd be really nice not to have to move to Meridian or Pocatello, those Twin Falls. And I'm sitting there thinking, wow, there are two bright young people that I risk losing if I don't look at having an online option. So we want to be progressive at ISU College of Pharmacy. And here's the reason why we are probably going to head that direction, at least in Alaska. Alaska is a huge state, right? Our College of Pharmacy campus is in Anchorage, but we have people in Fairbanks and Juneau who can't move to Anchorage for whatever reasons. Why would we rob them the opportunity to become a pharmacist? We've been doing distance learning before COVID was ever recognized. You know, I've got faculty, I've got 4 or 5 faculty at any given time. I'm down one up there right now. But that lecture live in Anchorage, and it comes to us in Pocatello and to us in Meridian, and vice versa. Our faculty here in Idaho lecture. Why would we not let that student take those courses online in Fairbanks, as you know? Now, admittedly, they'll probably have to come to campus occasionally because we do have some skills labs, a compounding lab, a chemistry type of compounding lab. But that's okay, they can come there. The institution I was at before coming here, very small college, but we started the first Doctor of Physical Therapy program online because hospitals were just desperate to get physical therapists. They have physical therapist assistants, PTA, but they didn't have the DPT. So what they agreed to do was to give their PTAs time off. They would do their courses online all over the country. We had somebody in Denver, Colorado, I remember that first cohort. He came to Knoxville, Tennessee 4 times a year for 10 days for applied skills labs, you know, range of motion and all the things that you learn from PTA or DPT. We can do that same thing in pharmacy. So we were going to look at how our college is operated. We just turned 100 years old, and I left there in the book our snapshot of our centennial celebration. What a better time than 100 years later to start looking at the next 100 years and how we're going to provide education. I'm excited about that opportunity. Again, we're already doing this. And I said yesterday over the Twin Falls, and if you're not a morning person, the Pharm.D program in Idaho is ideal because we don't start classes till 10 a.m. in Idaho. It's 8 a.m. in Anchorage, right? Because it's live, synchronous. Well, Zoom is our platform that we may end up using now instead of our old prior DL with Codex and all those kinds of things these days. You probably know about it. But yeah, it's a great place to come to pharmacy school if you're not morning first because you don't start till 10. So that the folks up in Anchorage don't have to get up at 5 to be in class at 6, right? So anyway, that's an overview of what we're doing, what's happening in pharmacy. A lot of the other professions are expanding too. We were talking yesterday about physical therapists. There's an example. In the past, you had to have a medical order from a physician to be able to obtain physical therapy. Not anymore. Most physical therapists can see a patient without a medical order. Some states have something about, after 7 days, if the patient is still suffering, there's not any improvement in the knee or the whatever, the hamstring, but you have to send them to a physician. But independent practice is becoming more and more visible among the different health professions. The control of some of those professions is now being opened so that we can meet the needs of the people that need health care. And we're behind that at ISU College of Pharmacy. Any questions of me about College of Pharmacy?
I was curious about the pre-pharmacy courses, like if I took them, say like here at Boise, would the credits like transfer over so I wouldn't have to take the courses or would I have to retake them?
Yeah, they transfer. When you apply to ISU or to any college of pharmacy. What you take at your, like BSU would meet our prerequisite requirements. Yeah. So like Chem 1, 2, organic Chem 1, 2, biology. And Aaron, you probably can speak to that better.
So you could try to do it yourself and just look at the Idaho State University Policy Guide and how you transfer to Boise State, or you could come to one of us. And we can tell you exactly what to take.
Yep, that's why.
I probably
yeah.
Because we have a very good, strong relationship with Idaho State University College of Pharmacy. And we bed things if things change, but like, for example, there's a microbiology course that's required in the pre-pharmacy coursework, and we usually typically have students take our biology 205, which is an introductory microbiology, but it is a medical microbiology, and it works just fine. The other one is biochemistry. A lot of students think that our Chem 350 or fundamentals of biochemistry is it sufficient, but Idaho State University has confirmed it. Cynthia Tilson has confirmed that that one works just fine. We have students taking it all the time. So yes, we know we know exactly how to lay it out for you so that you can take them in order so that you can obtain the pre-requisite pharmacy coursework, hopefully in 2 years. We do recommend that you get an associate's degree. You don't have to have a bachelor's degree for Idaho State University's program, but we also have lots of students who maybe bring in college credits and they're already close to a bachelor's degree. And there are a few states that might ask for a bachelor's degree for you to be in your licensure. So we recommend that you get a bachelor's degree if it's in the cards. But we advise to build it in a way that you could leave us and go to a pharmacy program without the bachelor's degree or with it, but we still want you to have your associate's degree so that you're core certified and you meet all of the core requirements. I always equate it to like going into Idaho State University with a Louis Vuitton bag versus a grocery bag. So when you have the associate's degree, you're carrying the Louis Vuitton bag, it's all nicely tied up in a nice little bow, it's all planned out. Whereas if you just go with the coursework, you're just kind of carrying a grocery bag and you're hoping there's not a hole in there somewhere where you're gonna have to take something out. But they do work with, the ISU program works great. Cynthia's awesome. She, if somebody had a question or concern, they could always reach out to her. We ask that you reach out to us first, just because we probably knew the answer. And then we can kind of go from there. They have some really great things though. So they have some ambassadors, some individuals who are happy to be in the pharmacy program right now that are happy to talk to you about the experience of being a pharmacy student at Idaho State University. I love the fact that you love the pharmacists, once they get through their first year, they can intern at a pharmacy so like they can work while they're going to school, so they can kind of earn their keep and manage, gain some experience, get interacting with patients and some of those things, and it can be a really viable opportunity there. I also like how the structure is too, because in one of those documents, it shows the curriculum. That last year is just plentiful. I mean, it's just, you're out in there getting your feet wet, getting experience, you're trying out all the different types of pharmacy that you can be a part of. And one of the fascinating things is, I think, is compound pharmacy. I think that's the coolest thing ever. Because basically they're taking a drug that you might take as a pill and transforming it into something else. So an animal can take it, or a child can take it, or someone's allergic to the dispensary tool, and so then they can give it to you in another format. And I was sad to see we couldn't do the health night this year, but I did it. So I'm hoping you guys do it next year. Next spring, they usually give us flu shots. You can go get your flu shot from that. Because they do, they administer vaccines. A lot of the pharmacists that come out of Idaho State University actually work for the policy part of it. They work with the government to make some of those laws he's talking about. Some of the changes to bring pharmacy even further into the medical community. And one of the really unique things I think is pharmacists get to work with physicians in the hospital, and they're alongside, they're rounding with the physicians, and they're talking to patients about the medications and the what they're using at home with their primary doctor and with the surgeon, if they are going through surgery or whatever it is. And they're talking to them about how that interacts with them so that they make good decisions as patients, and the physicians do too. Pharmacists are the experts in the drug, and the physicians are supposed to do the diagnostic piece. So I really think Idaho State University does a really good job of training pharmacists in a wide range of variety of choices in a really cool way, so that your education is in that first 3 years, your sciences, all of those things, but then you just go out and just be, and you're learning and you're growing as you do it. So it's a really, really cool program, and our students have really loved it. And as I said, last year we had 19 applicants and 18 of them got in from Boise State University, and they took all their coursework or most of their coursework from us, and then they transferred over there. You guys are using FarmCast for your centralized application service, so it's a nice tool. You can apply to multiple schools if you want, or just Idaho State University. Still doing early decision. You guys still doing that?
We have what is called early assurance.
Right.
The deadline for that's December 1st.
So you've moved that one, okay.
Yeah.
And then what's the deadline this year for the regular
June
traditional?
1st.
June 1st.
Yeah.
Okay. So you can build your prerequisite courses around what you need, and you can be in progress with some of your prerequisite courses when you apply. We can help you figure out the timing of that. But what's really great is that you guys usually start in July, don't you?
August.
August. So you can take a course in like the summer if you are short like one and you still want to apply, so it doesn't jeopardize your time frame. So you're not waiting the entire year to get back in, get into the process. So, and I intend to encourage another hosting of something like this, even with some students. That would be really cool to get some students. I know it's hard to ask the students because they've been told to do remote right now.
Yeah, I was going to say that we will plan to have Cynthia Tillotson. I know she's coming to Twin in October, so she may reach out to you about coming over here sometime, but also our student ambassadors. But also the advantage of you're just a couple miles from Meridian, you get to see the campus and meet the students over there.
Right.
So anytime that your students want to go, Jen Adams, who is my associate dean for academic affairs, is a graduate of BSU and Idaho State University College Pharmacy. So she's a great example. And you're right about the policy working in government. I serve on the Medicaid retrospective DUR board for Idaho, and there are multiple pharmacists who work for the Bureau of Medicaid and government. So VA hospital, there's all kinds of opportunity for employment as a pharmacist, and using that pharmacy degree. It's not expensive with medication, but it is consulting, making decisions about, think about these companies that manage pharmaceutical benefits. Most of those are done by pharmacists. And so if you like epidemiology and all those kinds of things, if a new drug comes on the market, the PB, the pharmacy benefit manager, has to quickly notify the employer, the sponsor of the plan, how many of their employees have that disease, that new drug covers, and if they switch to that drug, what the cost of that's going to be, because normally new drugs are more expensive than the older drugs that are on the market. So you did a great job of describing that. And your role in this process. And I was going to close with that and say, these folks are owed every gratitude in the world because what they do to help guide students to us and to other colleges of pharmacy. And your point about the associate, I'm still a big believer in the BS. If students want to say, I think that the maturity level of someone that comes to us literally as a junior at college, if they did the 2-year pre-pharmacy route, doesn't have the maturity that a 4-year BS degree holder has.
If you look at the statistics for Idaho State University that he provided, and for any of the students that are watching the recording, I can provide the same information. It's also on their website. There is probably almost half of the students who have bachelor's degrees, and that helps them become more competitive. That's a way to be more competitive. That's to demonstrate, okay, I have the ability and the knowledge to be able to get a degree. But I get it, there's also the benefit of wanting to get out and get into a career. The only question I have is, so I have a student who's very interested in Botox. So pharmacists, would they be considered under the ability to be able to not necessarily administer without the further training, but would they be considered enough of a health provider to be able to go through a training to be a Botox infuser or?
I don't know the answer to that. In most states, they have separate licensing laws for medical spas, which is where most of that product is administered. That does normally require a physician, medical director. As far as being able to go through a training program to administer, I'm sure we can put something like that together. But I don't know if state law would allow it or not. This is what I'm not sure about. But it's a great idea. I'm making a note of that because
Well,
there's an opportunity that I hadn't thought about.
I don't want to circumvent the process. I want to be able to advise the student appropriately. But that has been something that has come up. I know that currently Botox, you have to be a nurse or a physician. And you do have to go through further training to even still do it. So
Yes.
I just, she's interested in this field, but she's also interested in pharmacy school. So I don't want to hinder her, but I also don't want her going down the process of having someone there. So,
No,
do you
that's,
have any other questions?
I was curious about if there are scholarships that I
There
could
are.
apply for.
yes, we give about $500,000 in scholarships to our students. So there are scholarships. The way the financial aid is structured, you'll apply for it's called a grant plus loan. But we do have scholarships, yes. And in fact, we give entering students scholarships who have high academic performance. So the higher your GPA, the more likely you are to get a scholarship from us for coming to ISU.
Elizabeth, are you an Idaho resident?
I'm in Oregon.
So here's something to think about too. The Idaho State law has changed for professional schools. So they actually, you won't have an out-of-state tuition for a professional school. And that's why we have an increased number. If you look at the statistics of out-of-state versus in-state to Idaho State University. So that's a new policy that they can grant in the state of Idaho for someone who's interested in applying. So Idaho State University accepts, I haven't checked the new stats, but you guys accept a few more out-of-state students than you used to.
Well, yeah, and what's happened, California, just a few years ago, had 4 colleges of pharmacy. They now have 13.
I think that's why you guys have a smaller,
it-
because there's more schools to apply to. I think we have
we've
an
gone,
abundance of school choices now.
in the last 10, 15 years, we've gone from 74 to 144 colleges of pharmacy.
Right.
And that's why I say we have more seats than we have applicants, and because we've got so many schools. And the pool has dropped off. So, like I said, it started, now's the, if you want to go to pharmacy school, now's the time to apply. And, but I still want you to have an outstanding GPA and